The Hartford HealthCare Heart and Vascular Institute at Hartford Hospital recently performed its 2,000th successful transcatheter aortic valve replacement. Here today to talk to us about this major milestone is Dr. Jawad Haider, co-director of the Structural Heart Program at Hartford HealthCare's Heart and Vascular Institute. Doctor, welcome.
Oh, thank you very much. Thank you for having me here.
This is exciting. So first, talk to us about what is TAVR. What is this procedure?
So TAVR is, as you already said, transcatheter aortic valve replacement is a minimally invasive procedure that is used to treat the damaged or diseased aortic valve in patients. Now, for those who don't know, aortic valve is the main valve that controls blood from the left ventricle, that is the main pumping chamber of the heart, into the aorta, which is the artery that arises from the heart and supplies the blood to rest of the body. And in certain patients, this valve gets narrowed, and the only treatment that's available to us is a valve replacement. Previously, the only treatment we had was open surgical replacement or surgical aortic valve replacement. But over the last several years, TAVR has really taken hold and this is a minimally invasive way of doing the procedure, which does not require patients to have a stenotomy, which is we don't open the chest up to do the valve, but actually go through the leg and through very small incisions, and we are able to do this procedure safely and with minimal pain to the patient.
Doctor, who typically needs this procedure?
So our typical patient is an elderly individual, more than the age of 70, although it can be seen in younger individuals as well. Most of these patients are having shortness of breath or fatigue, and they go to their primary care doctor or their cardiologist, who usually detects a heart murmur. With that, they lead to further investigations that include an echocardiogram that shows the narrowed heart valve. Certain other investigations are then performed, and then the patient is referred to us, and then we take it over from there.
What can a patient expect going into this procedure?
So when the patient comes to us, they've already been diagnosed with aortic stenosis, or sometimes we diagnose them when we see them. We look through their records, we look through all the imaging studies that have been performed, and then we actually perform certain other tests which are done at Hartford Hospital that include CT angiogram of their heart, looking at the heart, the peripheral blood vessels. The patient is also evaluated by a multidisciplinary team that includes an interventional cardiologist and a cardiothoracic surgeon, our physician extenders, and advanced access providers who help us assess the patient. We also take care of all these tests. And then as a result of that, the patient comes to us. We will go ahead and do these tests, evaluate these tests, and then make a treatment plan for the patient. And then we go back to the patient and the physicians, and then the patient comes in for the procedure. And the patient, to be honest with you, has the procedure. They're up and about the same day and home in a couple of days.
That's amazing. Well, we want to congratulate you on your 2,000th procedure, big day. And we thank you for being with us and explaining this procedure. Dr. Haider, thank you so much.
Appreciate it. Thank you for having me.